Bunions can be unsightly, painful, but could a new, less invasive surgery eliminate them with less downtime? Board-certified orthopedic surgeon Dr. Johnathan Kaplan performed this new bunion surgery on Alyssa, and they both join us now.
Welcome.
So, first things first, before we even get to Alyssa and how she's doing, what makes this surgery different, Dr. Kaplan?
So this surgery is different from the traditional procedure in that the traditional procedure involves making large incisions in order to correct the bunion. And this is different because we're making a series of small keyhole incisions. We're able to get great correction through these small incisions.
And so, Alyssa, I notice you're wearing heels.
And
How are you feeling after your surgery?
I'm feeling great. Originally, I was pretty nervous about it. My mom had had bunion surgery in the past, and I had seen her go through it. And I'd seen her been in a huge cast and not really be able to put any weight on her foot for an extended amount of time. So I was pretty intimidated for this procedure and pretty intimidated for the recovery. But I was up and walking immediately after surgery. 6 weeks later, I was out of my surgical shoe. I never even had a boot go past my ankle. So it was very easy, and it was a lot less painful than I had anticipated, which was a great surprise for me.
So is that just because the surgery is less invasive that the recovery you could expect a quicker recovery?
Yes, so because of the fact that we're not disrupting the soft tissues, there's less swelling, there's less pain, there's earlier motion, patients are able to walk right away, there's earlier return to activity and earlier return to shoe wear.
Is this something that can be done for all bunions, or if you have a more extreme case, then you may need a more invasive, bigger procedure?
This can be done in most bunions. It can be done in mild, moderate, or severe bunions. There are some anatomic variations that it can't be done, but the majority of patients can have this procedure done.
I'm curious because, Alyssa, you clearly got these at a very young age, and you tend to think of older people developing the bunions slowly over time.
Anyone at any age, we know that there's a strong family history of it, as it was in Alyssa's case, and so we know that younger patients, when they have bunions, they're more likely to have symptoms because they're more active, so they're going to experience it during activities, and because they want to wear high heels, and so they're more likely to feel pain in that case as well.
So, Dr. Kaplan, if someone is not quite ready for surgery, are there any non-surgical options for bunions first?
Of course, we always want to try non-operative treatment. That includes various pads that you can wear on the bump in your shoes, toe spacers that can help prevent rubbing of the big toe against the second toe. And we recommend modifying the shoes to a shoe that maybe has a wider toe space, or what we call a toe box.
Oh, you know what? It's funny you mentioned that. I've fallen in love with the wide toe box.
Yeah.
You make fun of me, Drew, for the shoes I wear now, but have you seen the ones I'm not wearing them right this second, but oh my gosh, wide toe boxes are everything, folks. It's amazing. Yeah, it's all about wide toe boxes these days.
Oh, I like the X in the chat.
Well, and the funny thing about it is so many shoes nowadays, they cram your toes in there, and I'm assuming for you, Alyssa, it was almost impossible to wear any fashionable shoe.
Comfort became my biggest concern. I could worry about being cute in what I liked second, because the heels, I could barely get my foot in them without immediately feeling pain. I played soccer growing up. My cleats were getting super uncomfortable, and you can't play soccer without a cleat on your foot, you know? So it started to become all about comfort, and that was a really big bummer for me because I like dressing up, I like feeling cute. And when that can't happen just because something with my body naturally occurred, it's a really big bummer that that's gonna impact me for supposedly the rest of my life until this happened.
Well, I love that there are more options, and incidentally, I think this is a nice follow-up to the first segment where we said make sure you're wearing the right contact lens for you. I think it's making sure you're wearing the right footwear for your foot shape.
Absolutely, I agree 100%. It's really important to modify your shoes based on your unique foot.
Awesome, I love this. And is there anything that we can do to prevent them? Is there anything, if you're maybe starting to see a little bit of that bunion, anything I can do other than changing your footwear, or are you just gonna have to just roll the dice and wait and see what happens?
Unfortunately, no. We have no way of preventing bunions. We know that even with these modifications, you're still at risk of having progression of your bunions and developing symptoms as that happens.
It's just a predisposition, isn't it?
Absolutely.
And I mean, sure, you can try with shoes and other things, but ultimately it's probably going to form.
Exactly.
Yeah.
Well, Alyssa, we are certainly very happy for you and your result.
Thank
Dr. Kaplan, thanks for sharing.
Thank you.
Appreciate it. We'll be right back. And also, we're going to have more information about this surgery on our website, thedoctorstv.com.